There's an old saying that says an ounce of prevention is worth a pound of cure. And initially, when I heard that when I was younger, I really didn't understand what it meant. But it's very true. I think what it is implying is that there are certain things that we need to address early on. And if doing so, then that prevents us having to deal with something on a larger scale later. And I suspect that that's true for cancer, which is what we're going to talk about today, that old dreaded disease called cancer. But, according to research and medical professionals, cancer is very treatable and sometimes preventable. So we're more than a little happy today to have with us Miss Aime Clance, who has all kind of designations as it relates to, I know that she's an oncology nurse, and we want to just have a chat about cancer in an effort to educate people, apprise people, and inform people about not only the preventative process, but the treatment process of cancer. This is a call to action.
A call to action.
I'm your host, Alex Haversham, and like I said, we have with us Miss Aime Clance. Tell us a little bit about yourself.
Thank you for having me. My name is Aime Clance. I am an oncology nurse navigator at the Peyton Anderson Cancer Center here with Navicent Health. I've been a nurse 16 and a half years, and I have a...
Since you were 12?
No, not quite, but I appreciate the compliment. And then I have a certification in oncology nursing, and I've been an oncology nurse navigator for 3 years now.
Okay, outstanding. So how did you get into nursing? When you were younger, did you want to be a nurse? But just
I did.
What pushed you into the area of nursing, and more specifically the area of oncology nursing?
Well, I actually grew up with nursing. My grandmother graduated nursing school in 1951.
Wow.
And my mother is a nurse, graduated when I was 4, and is now a nurse practitioner. I very much grew up with it. Wanted to be a nurse as a child, used to dress up for Halloween in my mother's nursing cap. And when I was in nursing school, my uncle was diagnosed with non-Hodgkin's lymphoma and went through chemotherapy.
Now say that disease again.
Non-Hodgkin's lymphoma.
Which is a form of?
It is a cancer with the type of blood cell.
Okay.
And it's in the lymph nodes.
Okay.
It's a type of blood cancer, and he went through chemotherapy and through treatment and went into remission. And due to his watching him go through treatment in nursing school, I felt a call to oncology, and I started there on the medical center's oncology floor as a new nurse. And through the years, unfortunately, he relapsed and passed away about 12 years ago, unfortunately. And through the years, I've always loved oncology, but I did other things too. I even worked as a hospice nurse,
okay,
which I loved. And as the years have gone by, I've kind of come back around to oncology, and I love it. I think it's very much my calling.
Okay. Now, oncology is the formal word for cancer.
It's the study of cancer.
The study
That's what the word means.
Okay, the study of cancer. Now, really, what is cancer?
Well, cancer is when what happens is every cell in your body has basically a shut-off switch, like a light switch in a way.
Wow.
And it tells those in your genetic and your DNA, it tells that cell when to grow, when to make more of itself, and when to die. Well, due to various things, sometimes genetics, sometimes our environment, things like smoking, alcohol, those cells change, they mutate. And over time, suddenly that switch is gone. And it hides from the immune system, because our immune system also is always scanning for those changes, but it's able to hide.
Wow.
And that's how tumors develop, because those cells start growing and growing and growing and growing. And that's how tumors come, because they keep growing on top of each other because they don't know when to shut off anymore. And that's how cancer develops.
So cancer is really, you know, for want of a better word, is tumorous. So, you know, because of the growth of the cells, then tumors are developed.
Yeah, that's when like our solid tumors that develop things like colon, lung, and different areas of the body, and pretty much any area of the body can develop it.
So you can have it anywhere because you got cells all over your body.
Your body is made up of cells all over.
Yeah, wow, that's very interesting. Well, let's talk a little bit about signs, you know, because, well, no. I want to ask you a question. Is the statement that I made initially true about an ounce of prevention is worth a pound of cure? I mean, is that applicable to cancer?
Yes, absolutely. There are some things that we can do to help prevent cancer from developing. No, not smoking, not using any kind of tobacco products. That includes tobacco chew and dip.
A lot of people think that's safer, you know, when they
but
just...
it's not.
Okay.
It's not. Limiting alcohol, because alcohol does take a toll on the body and can cause changes. Eating a healthy diet, as I always tell any patients that come in contact with us, just like your mama used to say, eat your vegetables, fruits and vegetables, less saturated fat, less red meat, very lean meats, proteins, can help keep us as healthy as we can. To try to prevent it as much as we can.
Okay, now, you know, with modern science, it's my understanding that treatment has really advanced as it relates to cancer. Now, let's go this way. How does one tell? Because when the cells first start growing, you know, what are the indicators, the signs that one may, you know, that you're in the early stages of cancer?
Well, it kind of depends on where the cancer's at, but the general signs are you having a change. You have unexplained weight loss, because cancer cells, basically they eat more.
Eat all your nutrients.
That's basically what they do. Since they don't shut off, they kind of speed up and they take more energy. So people will tend to, it's like, well, I've lost weight and I'm not trying to lose weight. And that's a warning sign. A lot of times they'll have this generally just not feeling well. Sometimes you'll have, if there's something going on in the lungs, you'll coughing, unexplained coughing. If you have blood, if you cough up blood, that's never good. That's never good. For colon cancer, you'll find blood in the stool. That's an early warning sign. And so screening for cancers is very important. Going to the doctor, getting your checkups, and getting your screenings when it's time.
How does the doctor screen for cancer?
Well, it depends on what kind of cancer it is. Like, because the human body is miraculous, and it's and each person is really so unique. So for for prostate cancer, for instance, we have the PSA, prostate specific antigen blood test, that we can see if it's high that something's going on in the prostate.
Now the PSA is really a blood test.
It is. That's a
Talk
blood
a
test.
little bit about prostate, because I know for African American men, you know, we'll talk about other forms, but I'm sure that's one of the bigger ones as a relates. And you and I have done a show before on prostate cancer. So talk about the testing for that.
So for the prostate cancer, the PSA, the prostate specific antigen, is.
See, I thought it was it's not analysis. It's not prostate specific analysis.
No, antigen.
ANTIOGEN, ANTI, well, whatever. Antigen.
ANTIGEN.
Antigen. So that's that test that you take, you know, to determine if one has prostate cancer. Now, that's a blood test?
That's a blood test. So when a gentleman goes to his physician, and as he's getting older, at the age of 50, or sometimes even younger if he has a family history of it, especially, The doctor's office does their regular blood work, and they can send for a PSA, and they take this one stick, and it's done. And you can look and see if that level is high. And if it gets higher, sometimes they'll watch it for a little while. And because it can also give off if there's like an infection, they usually will treat that first. Say maybe you have an infection, and they'll monitor it. And if it goes higher and higher and higher, that's telling the doctor there's something going on. There's a cancer there. And then they'll do frequently we'll do a biopsy to see, because we need to see what exactly it is we're dealing with.
Now, a lot of men become, apprehensive and afraid about, prostate cancer, and they think that it's, very detrimental. Talk about the process of treating prostate cancer.
Well, prostate cancer it can actually usually be treated early, quite easily. A lot of times we have different ways. We do surgery when we remove the prostate, called a prostatectomy, where we remove the prostate. And then also, let's say the gentleman doesn't want to go that route, they also will do radiation, where using radiation's high beam X-rays, basically. And we will put the radiation oncologist will put in seeds into the prostate, and it gives that radiation from inside out to kill that cancer.
And now, are there a lot of success stories as it relates to the treatment of prostate cancer?
Oh, yes. We have a lot of survivors. The gentleman who came on your last show,
right,
Charles Cross, he's a 15-year survivor.
Right.
And you can live a long time after being treated, and a very, very high success rate over, I can't even think of the thousands of survivors in the state of Georgia alone for prostate cancer.
So the key to that is, and we're talking specifically about prostate, but what I hear you suggesting is that if you are 50 or maybe even younger, but very certainly if you are 50 or over, then it's as simple as going to let them draw blood, and to do a specific antigen analysis to see if, in fact, one is infected with prostate cancer. Well, a lot of men, frankly, does that necessarily affect one's sex life?
Unfortunately,
I know y'all thought I was going to ask that question, but I did anyway.
And you're not the only one who asked that.
But I think it's important because one might, be reluctant to even test to see. And I mean, well, if you're dead, you can't be sexually active anyway. So, I mean.
Well, exactly. It can. Now, we have come a long way in treatment. I've been a nurse 16 and a half years, and we have come a long way in the treatment of all kinds of cancer. We have a new surgery technique with using the Da Vinci robot for prostatectomies when we remove the prostate, and that is able to spare the nerves surrounding the area that affect sexual activity, to where men do not have as much of a problem with that after treatment. Radiation can still do the same thing because it's all in that one little area. Right. But we've come a long way.
Yeah. Okay. Well, thank you very much for the prostate antigen section of this interview. Okay, let's move on. Let's move on to talk some about other kinds of cancer, because what I think I'm interested in, and I think that the community is interested in. Okay, so you can do a PSA, prostate specific antigen.
Yes.
To determine if one has prostate cancer. Well, let's go to other parts of the body, and I know that there's no catch-all for it, but if in fact you went to a regular a general practitioner, I mean, is there a way for a blood test to indicate whether or not, one may have extra growth in the cells in their body?
There is not just one specific test. Unfortunately, I hope someday that we will have that. But as of now, no. It is very site specific.
Well, Miss Aime, how do you get screened for cancer? I mean,
Well, it depends.
So
for like colon cancer, for instance, okay.
There's some early.
There's early screenings.
You the nurse, so I'm not going to try to.
Well, March is actually colorectal cancer awareness month.
Oh, outstanding!
Yes.
Outstanding.
So for, let's say, colon cancer, we have early
Well, let me
screening
interrupt
methods.
you.
Mm-hmm.
My mother died from colon cancer, and less than a year ago, I had a brother that passed from colon cancer, and the report is that my brother, had it for a while, and then it was in the late stages before he realized it. So, that's, I'm very, very interested in it. But, according to reports, there are some things that maybe one can do,
Right.
that maybe he could have done,
Right.
To detect it earlier. So let's move on up from the prostate to the colon.
Okay.
So let's talk about, how you determine or how you can test or get examined, if you please, for colon cancer.
Okay. Well, we have lots of early testing for colon cancer. We usually, for a person of average risk, that means they do not have any family history.
Let me interrupt you again.
50. Mm-hmm.
So I keep hearing you say family history.
Yes.
So evidently, that's something that we don't really think about very much. I mean, we all have relatives that died. So I guess what you're saying, that if a relative dies from a certain kind of disease, then it's highly possible that could have been transmitted from generation to generation.
We have done, the United States has done a lot of research, and we have found that there are genetic syndromes that put people at a higher risk for
I'm learning all these
cancers.
big words with you.
Yeah. So first thing what people think about for genetics is breast cancer. People think, oh, well, my mother had breast cancer, my sister had breast cancer. But it's not just breast cancer, it's other kinds, colon, for instance. So your mother and your brother both passed of colon cancer.
Yes.
So that's at a higher risk because you've had very close family members who had colon cancer. And it very well could be that you have something genetic. And we're doing constant research all the time, every day, specifically about genetics, because we're learning new things every day.
Because there can be a predicting
Yes,
factor.
absolutely.
That's applicable as a result.
So someone who has a family history, their parents, their siblings who have had colon cancer, we would screen them earlier. Or patients who have had it very young. When they have children, we would screen them very young. Because as soon as we know something's going on, the better we can treat it.
So what you're saying, I guess, is that even though it may be genetically generated, I mean, with testing and identification, then you still stand a good chance of being treated and maybe healed.
Yes, absolutely.
Okay.
Absolutely. So for someone who at first, what they recommend, because colon cancer is the second leading cause of cancer death in the United States, what we recommend, gold standard for testing for colon cancer is a colonoscopy.
Now, is breast the first? What's the breast? Breast cancer is the first.
And lung.
And lung. And
They're
then,
very high up.
Yeah, so, okay.
So,
Go ahead, I'm sorry.
For like our gold standard for colon cancer screening is a colonoscopy,
Right.
which everybody
Don't look at me like that. Yes. I know you were going to ask me yes.
Very good.
Less than 3 months ago.
Very
Okay.
good. I'm so glad.
I saw that look. So have you been
I was
tested?
gonna ask.
Yeah, I have.
Wonderful.
Yeah.
And people are afraid of that because what we're doing when we do the colonoscopy is we're taking a small camera about that big and inserting it into the rectum and going all the way through the colon with the camera. And it's both a screening, because we can see what's happening. We can look at the lining of the colon. But if we find something, a polyp, which is a growth in the colon, the doctor could actually go and remove it. If we remove polyps, the cancer won't form.
Because it starts with
It
polyps.
starts with polyps. So, but a lot of people are afraid of that. But you've had one yourself.
Yes,
the
ma'am.
worst part of the colonoscopy is the prep. We have to clean out the colon so the doctor can see.
The worst part is when you read it like me. Yeah. But I did it.
Yeah.
I did it.
But you slept through the whole thing, right?
Yeah, I did. I mean, but I'm talking about just having the cleansing element.
That's
was
the
pretty
worst
tough.
part of the whole
but,
thing.
you know, it's worth it. It's worth
It
it to get clean, and then, you know, the doctor can't see.
That'll save your life.
Yeah.
It's worth it.
Well, I'll not eat for a couple of days
Yeah.
in order to live another 20 years.
Exactly.
I mean, you know,
Exactly.
that's
It's a
what
worthwhile
about,
sacrifice.
You know.
There's also some other screenings that we can do that are stool testing, what we call a FIT test, fecal immunochemical test. And what that does, the doctor's office can give a card, and when the person has a bowel movement,
Right.
they take a sample of the stool and we put it on a card, and we're testing it for blood. Because that's one of the first signs of any kind of cancer is blood in the stool for colon cancer. So if it's positive, the person needs a colonoscopy.
You know, the other thing that may make it even more important, you know, is because just with the natural eye, you can't always see blood in the stool.
Right. Exactly.
So they got to put it under a microscope or take it through.
It does a chemical test and it changes color.
Right. Okay, so you can do the colonoscopy.
Uh-huh.
You can do the stool sample, and it relates. You can check the weight loss. You know, to see if in fact there are any indications. So does that pretty much wrap up ways to detect colon cancer? You could do the stool test.
Do the stool test, the FIT test. There's the new one that people I'm sure have seen the commercials for, what they call Cologuard. And
You mean the commercial on TV where you could
it's
get
got the box.
Yeah. What does it? What?
So that test is actually, you're sending your whole stool sample to the lab, and they are testing the DNA, because when you have a bowel movement, your body is shedding those dead colon cells, and it's testing the DNA to look for polyps and to look for cancer, because that would be shedding off into the stool. So if it is positive, you'd have to have a colonoscopy.
Okay, but then I mean this is being done commercially. Aren't they advertising that on TV
They
now?
are. They are.
But it is proven to
Yes.
work.
Yes.
Well,
And yes, and Medicare
Will pay
approves
for
that.
it.
Yes, they will
Yeah.
pay
So
for
I
that.
mean that means that there's no excuse then.
None whatsoever.
You know, if you're 50 or over, or even younger, I mean, it won't hurt to check if you're even younger. Then you know it's very, very painless, if you please, to get checked for colon cancer,
Yes.
and it's the number 2 leading cause of death. So if you want to live, and then it behooves one to go ahead and get tested. Moving on up the body. Let's talk some about lung cancer. And we've pretty much talked about, you know, it's kind of interesting that there are detection approaches, if you please, to determine, you know, whether one has cancer. Now, what about the lung?
The lung, actually, well, the number one leading cause of lung cancer is smoking. And we've known that for a long time. And unfortunately, we still have people who smoke. So that is the number one thing to do to help prevent it, is don't smoke. Don't start smoking. And if you do smoke, stop. Because once you stop, your body starts to try to heal itself. There is a screening for it now with the low-dose CT screening.
Say that again?
Low-dose CT.
Low-dose CT.
A CT scan. and they will scan the lungs to look for nodules, little growths that happen in the lungs, and there's various
So there's
criteria for that.
always the possibility of an ounce of prevention or
Yes.
an ounce of detection.
Yes, because
Or early detection.
yes, the earlier any kind of cancer there is, the earlier we find it, better off you'll be.
Right, right. That is so outstanding. Well, let's talk about breast cancer. You know, we don't want to, if we talk about prostate, then we got to talk about breast.
That's right.
Let's talk about breast cancer in women, then we'll just kind of wrap up everything. So, talk a little bit about breast cancer detection.
Yeah. Breast cancer is the best way to detect breast cancer is two different ways. Number one, first of all, women know your body, just like men know your body. Self breast exam every month while you're in the shower,
Just check.
examining your breasts.
And you're feeling for lumps.
You're feeling for lumps, anything that's not normal. When women go to the doctor to get their regular annual checkup, the doctor also checks it. But it's important for us to check it ourselves so we know what our breasts feel like.
Right.
And then also a mammogram, starting at the age of 40. And again, if a woman has a family history of it, even earlier, and getting a mammogram.
Right.
And a lot of women are afraid of it. I had my first one this year, and even though knowing what I know, I was a little nervous. But it's uncomfortable, but it's not painful.
Right.
And we even have a newer machines called tomosynthesis, which is a 3D mammogram, and it can see a lot better
Wow.
and with less pictures.
Okay.
And
I want to
better.
interrupt you because guess what? You talked us out of time.
Sorry.
Okay, that's okay. That's a good thing. But let's talk about, where a person can go. So if you're listening to this, say you can go to the doctor, then even if you don't have money, you can get some free tests, right?
Yes. We offer, both through the health department, through Navicent, we have a lot of offerings for screenings. We have several health fairs where we do free PSA screens for prostate cancer. We have grant programs for mammograms for women who are uninsured.
Wow.
That all you have to do is you call the breast center at the Navicent Health and talk to someone about, is there available, and apply for it.
Right.
And get this screening. And for colorectal cancer, definitely if you do not have a primary care physician.
So if a person wants to know more about the different screening and what's available, then they can just call Navicent Health.
Yes, call the Peyton Anderson Cancer Center.
Peyton Anderson Cancer Center.
At 633-8537.
633-8537. Let me congratulate you.
Well, thank you.
You've done such a phenomenal job. I understand better, and it's my hope that the listening and viewing audience also understand better also. This is a call to action.
A call to action.
I have had the pleasure of interviewing Miss Aime Clance, oncologist and
Oncology nurse.
Oncology nurse and occupational oncology navigator and all those certifications and all that good stuff. And take heed, and there's no reason to have cancer and not know it. And if you do have it and find out early, then with modern technology and science, then you can live longer. So it behooves you to take advantage of it. This is a call to action.
A call to action.
I'm your host, Alex Habersham. Thanks to Miss Aime Clance, oncology nurse at Navicent Health. Thank you.
Thank you for having me.